the growing program will only continue to grow if we had places to have the children pre- and post-operatively, as well as if they come in sick from home. And so the unit will go from a 10-bed cardiac ICU to a 20-bed cardiac ICU. In addition, Bonheur has never had a so-called cardiac step-down unit. So these are children who are still quite sick, but not well enough to go to the floor for their final part of their stay in the hospital, but well enough to not be in the intense cardiac ICU. There'll be 11 step-down beds. And so it allows us to open the bed spaces in the cardiac ICU without sending somebody out of the cardiac ICU too early.
New expansion that Bonheur is going to undertake will include a hybrid cardiac cath lab, which will be next to an MRI suite. So we have the capacity to move the patient between the MRI suite and the cardiac cath lab if and when we need it. The reason for that is there are several procedures which will require MRI capacity as well. As we continue to grow, we end up doing multiple cardiac surgeries, a lot more heart transplantations, which translates into multiple cardiac catheterization procedures for children. And as children get older, and children with very complex congenital heart diseases who end up living longer, they require very specialized imaging and interventions, which can only be accomplished by having a hybrid cardiac cath lab with MRI capacity.